Sharon has a background similar to mine, was in the business world, and then in Oregon came over to run a coalition. Many of you are from Oregon and know Sharon from there. And then went on to be a Joseph P. Kennedy Fellow, the House Ed and Workforce Committee under Congressman Miller. And then on to her illustrious career now, really. And even though you can't be an advocate as a federal official, Sharon really believes and lives the values that we live here at APSE. So I will say she's worked in disability policy for more than 15 years at state, local, and national levels. And let's see, recipient of numerous awards, of course, including 2010 Distinguished Leadership in National Disability Policy Award from CCD. And finally, she's, as I mentioned, the Principal Deputy Administrator for the Administration of Community Living and Senior Advisor to Secretary Burwell at the Health and Human Services Administration. So please welcome Sharon Lewis to APSE today. Thank you very much.
Well, good morning. It's great to be here. Thank you for inviting me back. I know that I saw many of you a few years ago when you were in DC. And it's lovely to be in a room full of like-minded folks, really trying to further this notion of employment first. I was teasing Ari and said, oh gosh, I shouldn't have let you go first because now I get to be the bad, evil bureaucratic government person coming in after you ginned everybody up with all the right values. But I think the good news is that we are actually operating within an administration that shares these values and really wants to see the opportunities for people with disabilities to participate in competitive integrated employment expanded. I wanted to start off today with kind of a compare and contrast in terms of two stories of two young people that I know personally, and talk a little bit about their paths and how they have diverged. So there's a young woman in my local area, I'm going to call her Jane, that's not her real name, but we'll call her Jane for today, who is just shy of her 21st birthday. She exited our local high school 2 years ago and started participating in employment services through our vocational rehabilitation program. The summer after she graduated from high school with a special diploma, she was working. She was working as a personal attendant care assistant for another young person with a disability. It was kind of a great match in terms of being peers and friends and being able to provide support. And then she also had a job working in a child care facility. And between the two jobs, she was working over 50 hours a week, both at a competitive wage. She hadn't gotten to a place where she was earning benefits yet, but she was doing that. But she also came from an environment where she didn't have a lot of family support. She didn't have a lot of folks advocating for her or with her, and really was at the mercy of the professionals who were going to help her ensure that she had a good life. So she quit both those jobs and went off to a campus-based program to develop independent living skills and employment skills for 9 months. And came back from almost a year on that campus with definitely some improved independent living skills. She had learned how to drive, and she had earned a certificate in doing laundry, which, as a parent of 3 teenage kids, I can see the value of that. But she had no job. And her dream of going to community college was gone. And she stepped backwards into working very part-time, and then realizing that if she worked too many hours, that her Social Security check would be affected. and we're now just shy of her exiting the education system, and she's working about 12 hours a week. And her prospects are dim. Now, I have another friend, a young man that I actually just spent some time with last week, named Max. And Max is also a person with an intellectual and developmental disability. And when Max was in high school, Max made it really clear to a lot of people that he had a personal passion around baseball. That Max is a person who loves baseball, and Max would love to find a way to work in the world of sports. Max had a family that advocated on his behalf for him to be able to participate in post-secondary education. Now, mind you, Max is a person who went into post-secondary education reading at a first grade level, okay? And so we're not talking about the difference based on acuity, okay? We're talking about really the difference based on supports, as opposed to Jane, who, actually took college preparatory courses in high school and did earn, a special standards-based diploma from her state. So Max went down this path and had a tremendous inclusive experience in a post-secondary environment, and then had services and supports available to him as he exited post-secondary school that allowed him to pursue his dream. And now Max works for the Boston Red Sox, and last week was acknowledged as Employee of the Month, complete with a presentation on the field and being on the Jumbotron, which he was very excited about when I saw him last week, and has a completely different world. He has friends, he's out of his parents' house, he has a career, not just a job, a career, doing something that he passionately cares about. And there's no reason that we shouldn't have more Maxes in the world and fewer Janes. We have the resources, we know how to do it, we have the capital, we have the human capital, but we have to make the choices. We're at this point of time, as Ari acknowledged, where the confluence of federal policy supports us in these goals. And Ari's comments are a good reminder that, as a parent, I sure am glad that my daughter wasn't born 100 years ago. We've made great strides. We are in the year in which we celebrate 5 years of the Affordable Care Act, 50 years of Medicaid, 50 years of Medicare, 80 years of Social Security, 40 years of the Individuals with Disabilities Education Act, and in July, 25 years of the Americans with Disabilities Act that tells us that our proper goals for people with disabilities are independent living, economic self-sufficiency, equality of opportunity, and full participation. And that means employment, because you cannot be a fully participating citizen in this country without having a way to contribute. And maybe that's contributing through volunteering, and maybe that's contributing through having a relationship with someone else in your neighborhood in which you do nice things. Or maybe, just maybe, it means employment, as it does for the vast majority of us. Employment is a lot more than a job. It's a lot more than a paycheck. For most of us, it's social capital. Max has social capital. Jane doesn't. Max has social capital because he's been included and been provided the opportunities through education and his employment services to pursue his dream. Jane has not. At the federal level, there has been a lot of focus, and I'll talk a little bit about the rule, but I'm going to hold on that for a minute, around these notions. And at the Department of Health and Human Services, Allison talked about, the Administration for Community Living. We established the Administration for Community Living in 2012. I think actually the last time I came to APSE was right after we had stood up ACL and brought together disability and aging programs and services. So we now have grown thanks to the Workforce Innovation and Opportunity Act and an entity that was the Administration on Aging at the beginning of this administration. At that point was about 90 people and about $1 billion in funding, is now about 225 people and about just over $2 billion in funding in programs and services and supports for people with disabilities and older adults. Still a drop in the bucket, right? Medicaid is $70 billion in long-term services and supports at the federal level. Vocational rehabilitation is, I think, at this point, about $3 billion. These programs are small relative to the need, but they're powerful. And the Administration for Community Living was established to really further this notion that people with disabilities have the right and should be supported to live, work, play, and contribute as fully participating members of our communities. So, as Allison mentioned, I'm a parent, and those of you who've heard me speak know that I don't ever pass up an opportunity to tell a Zoe story, so I have to tell a Zoe story today. The work is highly personal, as I know it is for many of you. My daughter Zoe is 18. She's one of 3. She's middle. I have 3 lovely daughters, and her participation and inclusion in society is as important to her sisters as it is to her, because without that, their lives will be fundamentally altered. If she cannot have her own life, their lives will substantially change. And we don't talk enough about that when we think about employment and when we talk about the person with disability in the context of the family. So Zoe graduated from high school last week. It was a really great week. It was a big deal. And we've worked really hard for 18 years to ensure that she's had an ordinary life, right? Who among us has an ordinary life? I'm yet to figure out exactly what that means, but a life that involves all the ups and downs that the rest of us experience, right? She gets the opportunity to make mistakes, she gets the opportunity to work hard, she gets the opportunity to have fun, she has the opportunity to experience joy, she gets the opportunity to be a member of a community. And she's growing up to be an amazing person. She has been fully included all the way through school. Allison, it can happen. You have to work hard, but it can happen. And she walked across that stage last week, not with getting the same diploma that all of her friends are getting, but having succeeded on her own terms. She participated in academic coursework. She was a writer on the school newspaper who had her own column and interviewed people all over the country and in our local community. She participated in a lot of extracurricular activities. She was a member of the chorus. Don't ever ask her to sing. It's better in a group. She was elected by her peers as both the homecoming queen and onto the prom court. She also she liked to call herself the Mustangs' #1 fan, because athletics were kind of like in the same category as singing, but you can't hide behind the team. And so she'd show up for everything, right? So this is a kid that would cheer on, not only the football team, but the wrestling team and the chess club. And when she's not among her community, she is missed. She belongs. And that is part of what employment does for people. It brings them membership, it brings them social capital, it brings them into something bigger themselves. Zoe also participated in 5 different internships throughout the course of high school with varying degrees of success. We learned a lot about what works, doesn't work, what kinds of environments and jobs are good for her. She worked in a restaurant, she worked in an office. One of her favorite jobs, it was actually working in a regional park that has a playground that's designed to be accessible for kids both with and without disabilities, and where she ran the carousel. So it was really cool because she got to turn it on and off, and sometimes people got really long rides. But that was okay with most of the kids. And what was great about that opportunity is that instead of being the recipient and the beneficiary of other people's goodwill, she was the contributor. She was there in front of other little kids with disabilities, seeing her as the person who was working and empowered. And we don't do enough of that. So to be clear, none of that's come easily, right? It doesn't matter who you are or how much you know. Having students fully included in receiving a meaningful education that drives towards employment in our school systems in this country is a challenge. It is a challenge for every single family. And if you layer in lack of education, socioeconomic status, cultural barriers, and underfunded school systems that are dealing with a tremendous number of kids who have a wide variety of needs, it's a perfect storm. And families have to carry the water. You know, we had our fair share of ugly IEP meetings. We had our fair share of dramas and trials and tribulations, the bullying, the social isolation in middle school, the challenges that lots of our kids experience. But I was lucky because I had the opportunity and I had families who had paid it forward ahead of us, who had said to me early on, don't let go of the dream, ignore all the can'ts, should nots, will nots. You know, we were one of the families that, you know, my daughter, we were told when she was 4 that she wouldn't read and she wouldn't live independently and she wouldn't work and, you know, she wouldn't do all these things. And she has proven them all wrong. As we know, many youth with disabilities will and can and should. But we don't do enough to ensure that families know those success stories, that our school systems hold these kids to high expectations, so that when they're coming out and they're beginning to work with you, they have those opportunities. We're very lucky. So she's going to college in one of the transition programs. You know, the new opportunity that we've created for students with intellectual disabilities. And now it's my turn to see if I can really walk the talk and get out of the way. And she doesn't know yet what she wants to do, but she knows that she's going to college so that she can get a better job and have a better life. I think there's a lot of 18-year-olds who don't really know what they want to do, and I'm glad that she has the opportunity to explore it. Tired of these conversations at transitions, like, okay, she has to decide. My 2 without disabilities can't decide. How? Why do we expect these kids to know at age 18 what they want to do? That's why we have to do work on the transition age around building person-centered approaches that address the needs of these students. I want to see the success that Max has had, that Zoe has had, for more of our transition age youth, and for more adults with intellectual and developmental disabilities. We have to acknowledge that we have a generation gap, right? We have this incredible opportunity that's been created by the success of all of that federal policy and state policy and hard work at the local level to ensure new opportunities. we also have a whole generation of people who are not provided those opportunities, and we have to figure that out. It doesn't mean that we let the status quo sit, but it also may mean that we have different approaches and that we are compassionate in understanding where we need to be disruptive and where we can be most effective and where we hit the need for consumer demand, in particular around the youth. So I want to talk a little bit about the federal policy that's occurring that can support all of this. You know, Ari presented some of it from an advocate's perspective, and I appreciate and share a lot of the things and a lot of the values that he said. And there are a lot of different pressures on the system. I know all of you are experiencing those. This notion of home and community-based services is critically important. There are a lot of things that converge to create success in employment. We know that the Workforce Innovation and Opportunity Act has a new focus on ensuring that people with disabilities are accessing competitive integrated employment. APSE has done a great job of commenting to the committee that Ari and I both serve on that's focusing on how we advance competitive integrated employment and reduce the reliance on sub-minimum wage certificates. And you know, that work will continue. That particular body is in the process of wrapping up our first interim report that I think will be out late summer, early fall, talking about what we need to do to advance competitive integrated employment. WIOA, the Workforce Innovation and Opportunity Act, also includes policy levers related to vocational rehabilitation and education, and the workforce system, the Employment and Training Administration programs to ensure that people with disabilities are incorporated not only into, I think as someone referenced yesterday, you know, special services and special places for special people, but that people with disabilities are incorporated into our general workforce initiatives and efforts, and I think we need to do more there. We also, at the Administration for Community Living, are working with 8 states in the Partnerships in Employment. Some of you hopefully came to the pre-conference session. I know that there was a whole session focused on what we're doing in those 8 states and what we've learned and what we've seen. And if you did not participate in that, please make sure that you track down the information or circle back with us or go to our website or contact our colleagues over at the Institute for Community Inclusion at UMass Boston who are doing the technical assistance on those projects, because we've learned a lot. And one of the things that we've learned, and I know that you guys all know this, but we now actually have data to support it, is that if youth with disabilities participate with vocational rehabilitation early, they have better outcomes. Huh, who knew? We know that youth who participate in employment before they exit their secondary school entitlement under IDEA are more likely to be employed as adults. Who knew? We know that states are really ramping up in terms of employment first, and we've seen investments, right? Alaska has committed over $1 million to do this work. We know that California is moving away from the sub-minimum wage certificates in their education programs. We know that Iowa is doing rate restructuring that's going to move these things forward. Missouri has done a lot of work and interestingly is working very hard on this intersect between family support and employment and understanding that we have to be having those conversations. So there's a lot of good work that's going on there in those states. Tennessee has moved legislation forward and is pushing in terms of a step-up program. I'm not going to go into the details on that. But, and Wisconsin has moved some significant policy changes ranging from ensuring that youth with disabilities who are participating in vocational rehabilitation are not assessed in shelter workshops and enclaves, because guess what? If you get assessed in a group environment, guess what they think you're good at? So moving some of these basic policy changes forward is beginning to move the needle. And so we're seeing if systemically we can address some of the barriers in how we implement program, we can improve the competitive integrated employment outcomes. The investment in post-secondary education is also really important. As many of you may know, the president has announced his significant push for access to community colleges. We need to make sure that students with disabilities are not left behind in that effort, and we should be looking at our post-secondary environments as important partners in improving our employment outcomes. At ACL, we've invested in the Think College initiative related to students with intellectual and developmental disabilities and supporting post-secondary education for that group of students and youth whom, 30 years ago, people would have said, no way. I mean, not unlike the Black Stork story, people in our post-secondary environments would have looked at students with intellectual disabilities who are not earning high school diplomas and said, they don't belong here culturally and elementally. And we've changed that. We now have 240 entities across the country in which students with intellectual disabilities are participating in post-secondary ed, and we have great initial outcomes. We know that in the demonstration projects, the 39% of the kids had paid jobs while they were in college. We know that 41% of the kids who are leaving these programs are exiting with a paid job. Post-secondary education has to be part of the mix, including for students with the most significant disabilities. And then finally, I want to talk about what Ari spent a lot of time on in terms of the home and community-based services and the Medicaid funding. Medicaid is, for people with intellectual and developmental disabilities, the largest purchaser of employment services. Okay? It is indisputable. Sometimes people don't understand that, as I already talked about. We also have to acknowledge, however, that it's a workaround. Medicaid is a health program. The dollars that we have that come to us to do employment services are considered health-related by the federal government, by the Congress, by the state Medicaid agencies, in how they're doled out, how the statute that established them is informed. And we have to think about our use of Medicaid dollars in the context of health-related services. It was interesting to see the show of hands in terms of employment services versus health services, because if you are providing employment services using Medicaid dollars, you are actually providing a health-related service. And one of the things that we have to begin to think about and talk about and move towards is how we demonstrate that participation in competitive integrated employment drives towards better health outcomes. Because we know that anecdotally, and we have some research base to demonstrate that, but an employment outcome unto itself with Medicaid dollars is inadequate. I'm just, it's the reality of the political context in which we're operating. And so we're doing a lot of work along the lines of talking about quality. For those of you who are in states that are asked to participate in things like the National Core Indicators, or if your state has chosen to adopt the CQL personal outcome measures, or any other number of tools. Some states have state-specific tools. Wisconsin is peonies. I mean, there's lots of different tools out there. That work is critically important because we have to be able to connect the dots between the health-related funding that we use for these purposes and quality of life and health-related outcomes. Okay, so that's important, and it's important in the context of all these other issues that I hear from many of you related to, we want to pursue competitive integrated employment, but, right? Let me guess, the list of buts. The rate doesn't support it. Families are struggling with how to make these pieces fit together. The families want people to be safe. The families want the transportation and people to be in day programs, and we don't have employers to work with, right? So those are all barriers, and we know that those are barriers. What we've tried to do with the home and community-based settings rule is to use the structure of the federal regulation in terms of helping states understand what we mean when we say home and community-based. You'll note that it's not home-like and community-based like. It's home and community-based. That the use of the federal dollars should further that agenda. We have to acknowledge the reality of the system that we have, though. I mean, I think that all of us, certainly within the Department of Health and Human Services, have to acknowledge the high number of comments that we got in the development of, as Ari so aptly described, the rule through multiple comment periods, and that we've bought a lot of things that maybe we shouldn't have. And that we have to figure out a way to move those systems forward. That's why states have until 2019 to implement the settings aspect of the rule. Now, where we are in that process is kind of interesting. I was actually out at the National Association of State Directors of Developmental Disability Services a couple weeks ago and talked to them about this and said, guys, y'all submitted these plans. Some of them actually acknowledge that you've got stuff going on in your states that's potentially not compliant with the rule. But a lot of you did what Ari described, which is you plan to plan to plan. And we're scratching our heads trying to figure out how you're going to come into compliance by March of 2019 if you spend the whole transition period planning. One of the things that all of you should know and you should take home to your states and that you need to stay engaged in is that if your state did not submit a plan that is very clear and specific in how they have assessed their system of home and community services for compliance with the rule, down to these are the settings that we're going to subject to an additional level of scrutiny to ensure that they're compliant, complete with literally places, addresses, knowing what that looks like. If it's a plan to say, oh, we're gonna assess, and this is gonna be our process to assess, the state has to do another public input process. And all of you need to make sure that you're commenting on that. That's the vast majority of the states. Most states have come in with a plan that says, this is how we're gonna assess, and this is how we're gonna determine whether or not this setting is okay or that setting's okay. And that's great, and we're gonna work with states on those milestone plans. But if a state is put in for a milestone plan, which again is the vast majority of states, I would say that's over 40 states, then they have to do public input again. And you all need to make sure that you're engaged in that process and ensuring that through not just a quick look at what the setting is, but through the policies, programs, and procedures that the state is implementing, that they're implementing consistent with the rule. Are the rate structures supporting the rule? Are person-centered plans supporting the rule? The transition plan is about the settings itself, but there's a lot of ways to demonstrate compliance that states can come in with that will help with that, and I hope that all of you are remaining engaged in that. The home and community-based settings rule is very, very clear in that a setting cannot create barriers for an individual to participate in the community, and that the individual has to have access to the community to the same degree as a person who does not receive services. That doesn't mean that people have to completely blow up everything that they're doing, but they have to look at through the lens of, are we pursuing this optimal service? The other thing that's important to note about this point in time around the rule, for those of you who know Medicaid policy, you'll know this. For those of you who don't, bear with me. Medicaid is often said in the context of waivers, which is how we purchase these services, that you can't shut down a service to a certain population and then continue to provide it to other people, right? That would be a waiver within a waiver. Maybe you've heard that term. We can't do that, right? You can't say, okay, you know, you're paying for sheltered workshop for these people and you're gonna shut the front door and in the same waiver not allow other people to enter. In this period of time, we have that opportunity because of these transition plans. We have said from HHS's perspective, from CMS's perspective, you can shut the front door. You can ensure that new enrollees, youth, new people coming in, as long as they're receiving services that are person-centered and meet all the other requirements of the Medicaid rules, you can say, no, that service is, we're closing that service out, or we're closing out that setting and providing the service in a different way. That is unique to this moment in time. And we have to use that because I do think that Ari is right in that this is not unlike deinstitutionalization where we're going to hear the barriers and the concerns. But it is different in that we don't have a closed box. We don't control all elements of the system. We have to work with employers, we have to work with our communities, we have to work collaboratively, and we can't just do it ourselves. And it's going to take time, and we know that. So I hope that you will stay engaged in terms of the rule. I think the other thing that's really important in terms of the implementation of the rule and in terms of the implementation of competitive integrated employment is that point that I made at the beginning. We have to do this holistically. When I hear again and again and again, but the families, it's not fair. We have to do this in the context of the reality, right? We've been so successful with deinstitutionalization that 85% of people with intellectual and developmental disabilities are not living in provider-controlled settings, right? So what does that mean where they're living? They're either living independently or they're living with families. And if they're living with families, there's more than one person that we have to consider. When I hear families defend sheltered workshops, they're not defending them because they think they're particularly optimal. They're defending them because they know they can count on the transportation, they know the hours, they know the stability, and they can get up and go to work in the morning and make sure that the rent is paid or the mortgage is paid. And until and unless we have a conversation and we partner with our folks that are working on family support issues, when we're working on wraparound issues, we're not going to be successful here. And I think that's really important. It shouldn't be an excuse, and it shouldn't be a reason not to do it, but we have to acknowledge context, and we have to acknowledge that one of the biggest barriers to competitive integrated employment for people with the most significant disabilities is not directly tied just to employment. It's tied to all those other factors. And if we're not working holistically with our partners, whether those are partners doing family support work, whether those are partners in the education system, then we will not succeed in competitive integrated employment. And we will see more families who are pushing for villages and farms and other keep people safe approaches that we know are the failed policies of the past. But we have to do this holistically, and we have to do this in partnership. You know, we, within the administration, have put forward proposals that, of course, our friends over on the Hill have chosen not to fund, that would allow us to further some of these conversations related to transition-age youth around family support, things like that. But you also have a lot of tools at the state level. You shouldn't need to wait. If you're not already engaged with the activities in your state around supporting families, you need to be. Because you're not, you know, I'm guessing that many of the people that you're working with are living in the context of a family. Are you doing person-centered work that engages everybody? And it doesn't mean that still the person isn't at the center. You know, and we know that there are a lot of challenges to that. one of the things that we're working on at the Administration for Community Living is furthering the notion of supported decision-making, because we also know that when we create a black and white paradigm around an individual's rights being removed from them through guardianship or other restrictive measures, this conversation becomes much more difficult. And so we're working on furthering supported decision-making and ensuring that the person with a disability has the choice and control to which they are entitled. And I think we have a lot of work to do in that area. So much to be done, but much also to celebrate. I mean, I think, you know, we had an event this week celebrating the 16th anniversary of the Olmsted versus LC decision, and I sat with Judy Heumann. Many of you may know Judy. She's a longtime disability rights advocate. Was involved in the 1973 HEW protests at the Department of Health and Human Services to make sure that we had regulations under the Rehabilitation Act, right? So she's been doing this for a really long time. And we talked about how much we have to celebrate. We talked about how quickly, 98 years that Ari referenced, in the span of things, is not very long. We've come a really long way. We still have a long way to go. And it's pretty appalling that we were even having that conversation 100 years ago. But when I look at that through the lens of a parent of an 18-year-old, or the parent of a 5-year-old entering kindergarten, it's huge. And we have so much to celebrate. And we have so much to be grateful for. And we have so much improvement in our diversity of our communities, in that people with intellectual and developmental disabilities and other people with significant disabilities are contributing members who are missed when they are not part of our workplaces and our communities. And APSE has been at the forefront of that for a long time. So I thank you for your passion, and I thank you for your work, and I hope that when we're having this conversation in another decade, we're not talking about sheltered workshops anymore. Thank you.